Gary Thomas from the Wealth Technology Group. You're looking quite well today. How are you?
Well, thank you. We're vertical. And speaking of vertical, we were mentioning that this month, of course, is Elder Law Month. But coming along with any kind of elder law and any kind of asset protection advice is the fact that all of us should have something called a health care proxy.
Uh-oh.
And what is it? And you think of, is it one of those things that you sign bleeding going into the hospital? Here, sign here. What is this document?
I'll sign anything.
Right, basically, just get me admitted, but or it depends on where you're being admitted to. Any event, what a healthcare proxy does, it allows you to essentially appoint a healthcare advocate for you, a family member, a partner, a spouse, a son, a daughter, basically to take an active role in managing your health care if you're just too sick or hurt to do so. Now, if you can speak up, you're the boss. But if you can't speak up, then it's the job of the healthcare agent, that's a person that you've appointed through the healthcare proxy, to essentially be able to look at your medical records, okay a course of treatment, veto a course of treatment, hire a doctor, fire a doctor, move you from one facility to another, have complete access to your medical records, which without a healthcare proxy would be frozen because of the Health Information Protection Act, HIPAA, Privacy and Protection Act that was passed. So basically, the role of a healthcare agent, which is who you appoint with a healthcare proxy, is to take an active role in helping you get better and really discuss with your physicians and medical professionals what to do. Without that, let's say if you have 3 children and they're trying to discuss what's the course of treatment. I mean, do you flip a coin without appointing someone to make some choices for you?
Heads I win, tails you lose.
Exactly. Let's see, what should we do with Pop? 2 out of 3. So you want to appoint a family member, a partner, a spouse, someone that you care about dearly that will be involved, that will be relatively close in case there's an emergency, that is proactive enough if they have to ask a physician for a second opinion to do so, but also to be seeing enough to be aware, is mom being over-medicated here? Sometimes sometimes people fall through the cracks in the medical system, so you really do need somebody there to take an active role if you're too sick or hurt to speak up.
I've seen cases, a couple of cases, where a proxy is assigned to a person, but the person can speak up and wants to speak up. Nonetheless, the court has assigned a proxy. What's that about?
The court doesn't. That basically is a different proceeding. A healthcare proxy is a document where you have appointed that individual. So, in order for your role to be shortcut, basically, then normally before a court will go against your wishes, people would have to prove that you're incompetent in some way. It might take the testimony of 2 or 3 physicians, but it's not something that's automatic. And when that in fact happens, basically there's usually a long drawn out court proceeding. By the way, without a healthcare proxy, then that proceeding is going to happen anyway if somebody has to take an active role in helping you. So basically, the healthcare proxy allows you to appoint who you want, because if you can't speak up, if you're incapacitated for some period of time, then your family members, partner, spouse have to move toward a guardianship proceeding, prove that you're basically not capable of speaking up for yourself, and be appointed to take an active role in helping you.
Healthcare proxy.
Very, very important, not to be confused with other documents such as a do not resuscitate order or a living will. So everyone should have it, no matter what your age, whether you're a millionaire or thousandaire, whether you're old or young. If you're out in the community, you need to get that very essential legal document. By the way, anybody have a question for me, they can email me at Gary@wealthtechnology.com, because it's not what you make, Bob, it's what you keep.
Very nice. Very nice. Very, very catchy, yes. People,
Like colds.
Yes. People have called for a proxy for me here on the radio. They said, "Kids, you get a proxy for Bob. Do not resuscitate." That's another one.
But they know that you have been resuscitated.
In some way. Well, thanks, Gary. Gary Thomas from the Wealth Technology Group, who joins us a couple of times a week. And you can catch his show On the Money, 2:30 on Wednesdays and 10 a.m. on Saturdays. Thanks, Gary.
Thank you.
It is 7:58 right now in the morning on WHMP, and we'll be talking again as the day goes on here about the